Good afternoon, and welcome to HealthSystemCIO.com's All-Stars panel, Leveraging CRM for Improved Patient Engagement and Population Health Management, a webinar tweet chat combo from HealthSystemCIO.com, sponsored by Silverline. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the Editor-in-Chief at HealthSystemCIO.com, and I will be your moderator today. We are having a simultaneous tweet chat hosted by Kate Gamble, our Managing Editor and Director of Social Media. You can participate in a separate browser or on your phone by using the hashtag HSCIOchat, or you can simply view the tweet chat in the Media Viewer panel on the right-hand side of your screen. We'll also be using the Q&A panel today. You can use that to send your questions in as they occur to you. Leave the default set to all panelists. We'll take those later in the program. And we're also going to put out some poll questions to our audience today, and the polling panel will automatically open when we do that. You can also download the deck using the URL on your screen, and it's at the bottom of some of our slides, and it has been sent out in the chat box. Just so you see how we're going to spend our time today, first we're going to have our panel discussion featuring Doug Ditri, Chief Access Officer with Henry Ford Health System, Matt Gretczko, VP and Head of Healthcare Practice at Silverline. So let's jump right into our discussion. Doug, let's start with you. Can you give us an overview of your organization and your role?
Sure, I'd be happy to. My organization is Henry Ford Health System. We are located in Detroit, Michigan. We operate in 3 counties in southeastern Detroit. And just 2 years ago, we've also spread out into the central part of the state by acquiring a hospital in Jackson. We are a fully integrated delivery system. We have 5 acute care hospitals. We have a flagship hospital in downtown Detroit that is over 100 years old and was started by Henry Ford. We have 3 behavioral health inpatient facilities, and we also have a 1,300-member integrated medical group. In total, we have about 30,000 employees, and we have an academic mission. We educate over 1,800 providers a year. We have a research mission where we do nearly $100 million in funded research every year, and we deliver care in roughly 250 locations. My role is the Vice President of Business Operations and Chief Access Officer for the Henry Ford Medical Group. I'm primarily focused on the outpatient services of our health system. I have oversight of our front desk operations in all of our clinics, so the registration and check-in process. I also have oversight for our referring physician office that accommodates provider referrals from out of our catchment area. And most importantly for today's conversation, I have oversight of our central contact center, which has about 4 million contacts a year and schedules roughly 2 million appointments. We also manage prescription refills, questions for the office, our MyChart application for Epic, and many other sort of system catch areas. I have roughly 1,100 people reporting to me, and I sort of speak for the system in terms of scheduling with our Epic application.
Very good. 1,100 people reporting. How many direct reports?
I have 9 direct reports right now.
That's a pretty solid number to keep you busy, huh?
Yeah, it's a large role.
Yeah. Very good. Well, looking to talk more about it. Matt, a little bit about Silverline and your role there.
Sure. Thanks very much. Thank you, everyone, for the time today. So my name is Matt Gretczko, and I lead the healthcare practice for Silverline. Silverline is a Salesforce implementation and advisory firm. What's a bit unique about our organization is we are vertically aligned, and so I oversee everything that we do within the healthcare space. So we work with organizations that are providers, payers, medical device organizations, as well as some organizations in biotech and life sciences to understand how they can either initially start with a CRM or expand their footprint of a CRM. And so we're helping them envision the uses for the CRM application, a roadmap for them, and doing a lot of different and creative things along that continuum for these organizations. Doug is one of our customers, and some of the work that has been actively being done around their call center is work that we've partnered with them on. In my background, I come from a background of healthcare technology and consulting, and been doing Salesforce and CRM consulting for over 12 years.
Okay, very good. Doug, let's get right into it. Tell us why you decided to invest in a CRM solution. So take us through sort of the evolution of the need for a CRM, and then why you decided to go forward.
Sure. So we do have the contact center I described earlier. We have 400 agents. We have 70 that work at home. We have 330 that work on site. We do have over 4 million contacts a year, either electronically through telephone or through email. We also do some sort of, or some versions of web chat to support certain aspects of our business. So we're very complex in terms of technology and all of the things that we support. We do support, I mentioned earlier, appointments, questions to the office, prescription refills, MyChart support for Epic. We do interpreter services for our health system. We do a lot of different items. And we have a 1-800 number that people can call, and we need to be able to triage that call to where it needs to go, as well as maintaining over 500 other phone lines. So we began several years ago on our journey of saying, how do we organize all of these contacts? We really need to understand best what our patients need quickly. We all know that transferring phone calls is not engaging to the patient. And the first thing that we did was find a partner to implement an IVR, which helped us route calls quickly. And while that's an integrated voice recognition system, which I'm sure most folks here understand, but that really helped us route calls a lot more cleanly. And it did help us reduce the number of transfers for our patients. But we realized very quickly that it also helped us understand segments of our phone calls as they came in. And we really started to get the feeling that we needed to address these segments in a more speedy, to be more ready to deal with the segments as they were defined by the routing system. And the CRM is really what we saw as the vehicle to make this happen. We can actually capture why our patients are calling, and it can help to pre-populate some of the case that we're going to open for our patients. So if it's an appointment case, it's going to populate a particular workflow that we're going to have our agents work through. If it's a question for an office, there would be a separate workflow. Prescription refills will have another template. In addition, given the complex nature of our organization with the academic, clinical, and research mission, we get a lot of different phone calls. So we have to catalog a lot of information for our clinics. Many of our patients call because they have a question about hours or locations or services. And we try to manage all of that information in SharePoints through a variety of Excel documents, and trying to keep that organized was very difficult. The CRM was seen as a vehicle that we could use to house all that information in an organized manner that would be searchable and readily available to our agents, so we could get answers for our customers more quickly when they called us.
Two things come to mind, Doug. One is, and you tell me if these make sense, is putting in a CRM help you move from being reactive to being proactive? Absolutely.
I think once we have a good database of information about our patients, it can really help us be proactive in more than one way. It can help predict why a patient might be calling based on previous cases. It can help allow us to know when a patient called us with a situation that was not resolved, and we can set a tickler to call them back. But in addition to that, and something that we can talk about later in terms of what I really want to get done with using this tool, is we can take information outside of the CRM and outside of Epic, and we can populate it into the CRM and build what you might call a campaign, an outbound calling campaign. And we could use that for some health maintenance needs if we have a high-risk population, or we might be able to use it for a marketing campaign as we match some of our services to high-probability folks that are in need of it. So there's a lot of things that we can do to be more proactive.
And you mentioned that based on the type of call that comes in, the agent will sort of get a pre-populated screen of things they may need to do. That almost sounds like a clinician getting an order set that's going to help them not forget every, they don't have to remember every little thing every time. Is there a similarity there?
There is, although I think most of our clinicians wouldn't want to hear that this is clinical. But it does truly help guide the advocate, that most people call them agents, we call them advocates, it does help guide them in their work. And it gives them less to try to remember and think about, and hopefully spend more time engaging the patient and working on their customer service skills, not trying to remember if they checked off all the little boxes. So we expect that that'll be a big boon to them as they work through their what they're trying to collect on the calls.
Excellent. Very good. Very good. All right, Matt, let's go with you. How would you define customer relationship management in a healthcare context? Obviously, and you might be able to speak to, how it's different in healthcare versus other verticals that could be compared with it.
Absolutely. I think there's actually, I think Doug outlined a few of the reasons as to why organizations are going to CRM in healthcare. I think, in defining it, I think one of the key areas of CRM in healthcare is getting a more holistic or 360-degree view of a patient/consumer. Knowing that within healthcare there's often a whole host of different systems where that information sits. So as Doug mentioned, you have your clinical systems, you have your non-clinical systems, possibly a data warehouse, right? Possibly multiple systems based on various facilities and clinics and locations. And so where the CRM really, plays within the healthcare context is allowing you to establish a centralized profile or view of that patient across all interactions within your health system, whether that's one location or multiple locations, multiple service lines, et cetera. I think the other thing that it allows within the healthcare context is as we shift towards this move towards focusing more on value-based care and consumer-driven care, how do you drive that value prop and that level of patient engagement further to the consumer? And I think CRMs allow you to operate across multiple channels. And so where you talk about, email, text, web chat, video, both before, during, and after a clinical episode. And so you have that holistic view. You can communicate and interact across multiple channels, and you can do it before, during, and after an interaction. That helps ensure that you're providing proactive care, that patient stays within your network, and they're having a highly engaging experience. As you compare healthcare to other industries, I think what you're seeing is that healthcare is now trying to take some of the learnings and teachings from outside healthcare and bring that into the industry. And so two of the areas that constantly come up in conversations that we have with customers, I want to be more like hospitality, or I want to be more like retail, where if I walk into a store, they know my buying preferences, they know what I like, they know my history of purchases, or if I walk to the front desk of a hotel, they know I'm a preferred customer. Think about it in a hospital setting. If you have a donor, the second they walk in, you should know that they're a VIP. And so I think what we're seeing is that CRM as a technology, the use cases are actually pretty consistent outside of other industries, but now we're seeing being able to extend that into the needs of the healthcare space.
Matt, one of the things that IT executives and CIOs at hospitals are trying to do is provide, and this could be in any number of ways, a comprehensive view of the patient that brings in, usually they talk about it in the EHR, trying to bring in all the ancillary departmental information. You're not really bringing the revenue stuff in there, but people would love to have that one total view. And you're kind of saying it could be the CRM that provides a very unique, holistic picture of a patient. I mean, is that something that even clinicians might want to poke their head in once in a while because they're going to get one unique view?
That is exactly right. We are seeing the CRM as that engagement layer across multiple other applications to create that holistic view. I think Doug made a great comment. The level to which clinical information is surfaced in the CRM is going to be an organization by organization decision. However, it's first important to identify that the capability exists. The CRM is a platform that can allow for that. The question is how much and what information and what format do you want to surface. But we've seen instances where we're bringing pharmacy information, claims information into the CRM so you can really address any type of inquiry that a patient might have, but also do things that are proactive. And so where Doug mentioned, so the next evolution is how can you take health maintenance information coming from an EHR where you might do a segmentation and identify a population that hasn't had mammograms or a population that hasn't had colonoscopies, and when they call in with a question about scheduling a flu shot, hey, by the way, I noticed that you have not done these other things that are critically important. do you want to set up time to do that? That's where you really evolve the level of care and create a highly engaging experience. So short answer is yes, the CRM can serve as that focal point to consolidate information across the enterprise as it relates to a patient and create one unique instance.
Very good. All right, Doug, back to you. What were your ROI considerations?
The ROI considerations, weren't the typical ROI considerations. We did not sit down and map out exactly how we would get our return on these dollars. We really looked at our current patient experience of navigating our complex organization as dissatisfying and a threat to our business. And so my CEO and myself sat down and talked about the importance of improving the experience to engage the patients. That said, there's a whole list of things that he and I talked about that were potential ROI down the road once this was installed. And Matt just mentioned the health maintenance. I think we're going to be able to collect a lot of appointing for patients who needed it passively by noticing while we're working through one of our standard workflows that they are missing a mammogram or a glucose test or something that they should have had. And even more importantly, I didn't mention earlier, we do have a payer in our system as well with 700,000 members. We have a Medicare Advantage population that we serve, and we need to reach out to them several times a year. That's another opportunity to make sure that we get them what they need, so when we get our CAP scores and all the things that our payer is graded on, that their needs are met and we're not leaving dollars at risk. We have arrangements with other payers where we have dollars at risk due to quality or even population health spend. And these are areas where we may need to reach out and identify people. And those are the folks I was talking about loading into an outbound campaign to make sure that we're managing them well. The other issues that we tried to manage for ROIs was we wanted to be able to reduce the training time for our staff. It takes quite a bit of time in a complex situation like our advocates find themselves to train and to nest in their pods and learn. By creating stronger workflows and better accessibility to information that the advocate may need, we'll be able to reduce their training time. We're hoping to reduce errors. We're hoping to use the CRM to ensure that our customers are getting the right provider, the right location. They're being there, getting there in the right amount of time. And last, two more actually, it's very critical that we manage our referrals and reduce our leakage. As we create internal referrals or collect external referrals, we need to make sure that that information is flowing back and forth and that we know we've managed all of those referrals. We can load those in the CRM. And my last group would be marketing, and to a lot of organizations that probably wouldn't be last, but I'm not responsible for marketing. So for me, it comes last. And for them, they may want to load a campaign in the CRM, and what that means to me is if they want to, say, push our structural heart, our department, they're going to do a campaign outward and we're going to collect phone calls, they can give us the exact brochure that they sent out in a mailer or that they put on television or sent out through email, and we can load that right into our CRM and see the brochure and see exactly what the patient is asking about. We can load scripting to go right alongside that brochure, and we can provide the advocate exactly how to handle the patient when they call for that marketing campaign. So I expect that we'll get a large return on that. For us, the big thing is to first get our patients acclimated to it, and more importantly, our staff acclimated to using it. I think that the opportunities are nearly endless on how we could create value out of this by implementing this software.
Doug, can you just go a little more into the managing referrals and reducing leakage? I think that's the huge issue on the table for
Sure.
health systems.
Absolutely. We have, I think I mentioned earlier, we have a referring physician office. They've been using a CRM for years of lesser quality, but it's helped them organize their interactions with our outside physicians. Again, they schedule far less than 1% of our total appointments or take far less than 1% of our phone calls. So they've been able to get by with a pretty rudimentary tool. But the tool allows them to build a case every time they get a referral. They get to log exactly what they need to collect, where they are in their process of landing the appointment, of getting back to the referring physician office who sent it to us, of making sure the patient knows where they need to be, if they need any special help with wayfinding or meeting them at the airport or whatever we may need to do to bring somebody in. And lastly, to get that information back to the referring doctor and to make sure the patient gets back where they belong with their referring doctor. And all of that is built in one big workflow within their CRM to ensure that all of those are handled. Internally, we could leverage it in nearly the same way. We write referrals in Epic. We could populate those referrals into a CRM, make sure we touch them all and that we've contacted every patient. And we all know that not every patient wants to be contacted for every referral, and some have their own doctors outside. But what we really want to do is eliminate those folks that have a choice or haven't made a decision and may go home and find out that their mother-in-law knows somebody outside the system who can handle that need. We want to capture it right away.
Okay, excellent, excellent. One more for you, Doug. What did your evaluation process look like in terms of selecting a technology vendor and subsequently an implementation partner? You want to talk about that a little bit?
Sure. It was long. We talked for a long time about how we would use this tool and if we really wanted to explore this. We're in a large and old organization, so things tend to move slow. So first, we spent quite a bit of time looking at literature, studying online, and talking to internal networks. We talked to our IT folks. We talked to other organizations who had dabbled in this, and nobody had quite done what we were looking to do. But there is good information out there on the companies that do this and do it well, and we collected all of that. And ultimately, we set up a formal RFP through our organization, and we knew that Salesforce would be one of them, and there were 4 other ones that we brought in, and we talked it through. We interviewed them all. We went through the entire arduous process that our system has designed for us for our pleasure. And ultimately, we settled on Salesforce. They were really the only ones that had done much in the way of work on the provider side. They were also one of the only ones who could speak with confidence about any interactions with Epic, which is our CRM, and their reputation was obviously very solid, and they were so malleable that I knew that we could use them for the whole variety of items that I could picture using their software for. We picked Silverline. We really didn't look as many people as the implementation team. We were sort of, I don't want to say trusting, but we wanted Salesforce's opinion on who could help us do these things that other people had not done. And we reviewed only 2 or 3 companies there. Silverline was, I think the term is a platinum partner with Salesforce to do implementations. They could talk confidently about working with healthcare, and they had some vision on how this would be used in healthcare. Most of the implementation teams we met with were primarily concerned about internal efficiencies or how this got used in a different sort of industry, but really didn't have a healthcare line of sight when they were talking about the program.
Very good. Matt, can you tell me what being a platinum partner means for Salesforce?
Sure, absolutely. Fair question. So Silverline has various levels of partners. What that means to customers is we get evaluated on our customer satisfaction ratings, the level of certified and qualified resources that we have within our organization, as well as our experience with the Salesforce platform. And so Silverline is at the platinum level, which is the highest level you can be without being a global consulting firm. What's unique for us is, as much as we're at the highest level you can be, which speaks to the, caliber and level of resources we have internally and our vertical alignment, we're significantly smaller than some of the other platinum partners. And so we find, to Doug's point, I think it gives us a unique opportunity to really establish a roadmap and a vision with our customers, come forward with what we think really pushes the envelope and partner at that level with them. So that's what it means. It's a Salesforce designation, but it speaks a little deeper to the success that we have with the technology with our customers overall.
Doug, is this very common with large software implementations where it's sort of a two-step process? You pick your software and then you pick your implementation partner?
For me, this was a first-time experience with that, to be honest. Most of what I've worked with has been the vendor itself has their own implementation and project team. We went through a similar, the work itself wasn't similar, but maybe the size and scope. When we implemented our integrated voice recognition system, it was sort of, for us, on our side of things, as big of a project as this has been, and they managed it themselves. So this was a little bit different.
Okay. Okay. Any specific advice with the timeline or anything? Do you want to make both decisions at once, or did you do one after the other, software and then implementation?
I think you do it together. I think you really need those conversations back and forth a couple times, and we ran this concurrently. So I wanted to hear what Salesforce said they could do. I wanted to talk to Silverline to see what they thought, and I wanted to apply my own thought to that. And then I wanted to go back to Salesforce and get their view on what they felt could be done and what couldn't be done. And I really just wanted to make sure that both groups understood what our end vision was. And so I think it's important that you talk to both.
Very good. Very good. All right, Matt, why will the traditional approach health systems have been using to interact with patients no longer suffice? And I'd love to hear your thoughts on what the traditional approach has been and why won't it work anymore?
No, absolutely. I mean, I think, as you see from the fact that we're having a conversation around CRM, it means that, the healthcare industry is changing a little bit. I think what we're seeing is the traditional approach was not as focused on the consumer, right? What you're also seeing is some significant changes within the industry that are external factors that are forcing the need to really look at the way in which you interact with patients. A few items that come to mind for me that I think you're seeing, first is, increased competition and consolidation, right? I mean, years ago, you didn't really see a lot of ads on TV for hospitals, right? You see that now. And so there's a real need to compete. At some level, how you compete is the level of experience that a patient has and how satisfied they are with that experience. The second is now consumers have a higher expectation, right? They are now setting the standard and making requests of health systems in terms of how they want to be serviced. What capabilities do they want to have? What information do they want available to them, and how do they want to interact, right? They don't necessarily want to go to an office or a hospital now and fill out paper forms. They want to be able to fill out things electronically. And so as you get to a hump or a certain level of momentum, that forces change. A few other areas that come to mind to me in terms of why the traditional approach doesn't work anymore, and I think Doug mentioned this as well. I mean, you have an aging population as well as an increase in chronic illnesses. And so that requires a change in the way in which we interact with patients to reduce risk and ultimately reduce cost. You also have new and differentiating services, right? As technology has changed within the healthcare space, you have new channels to interact. Think about telehealth and video chat, right? As you explore those new channels, you need technology that can support those new channels, that consume the output of those channels. And so how do you create a model where you're able to interact with those things? And then finally, which should be no shock to anyone on the phone, I mean, the changing reimbursement landscape, right? Having to understand how you will get paid and what that means to your organization, the traditional approach will no longer work. If you stay at that traditional approach where you're focused on volume, right, and you're not taking value into consideration, then you're not focused on the consumer, that's going to be very, very challenging. And so I think what we're seeing is that organizations have identified that we're now past the large EHR investments. EHRs are very, very good at what they do on the clinical side, and many organizations might use it to run a large majority of their organization. But now we're seeing some of these additional gaps or areas that consumers are requesting that the industry is forcing upon us where CRMs can come into play. And so that's my view of sort of how the landscape has changed and why the traditional approach no longer works.
Very good. Thank you, Matt. Doug, back to you. How did the goal to improve patient engagement factor into the investment?
Frankly, that was our #1 goal. That was, getting our patients engaged, and I would use that word multimodally. I would say getting them engaged in their healthcare, getting them, engaged in their interactions with us and appreciating us more, and getting them connected to all the places that they need to be when they call our system. I think what Matt was just saying is of real significance. The EHR is doing an amazing job of consolidating healthcare information and giving you the prescriptions and telling you the patient history and maybe even what they need to do next in terms of healthcare. But what they lack is an ability to transfer sort of transactional information, both financial and clerical, between support staff. And the clinicians really don't want the medical record cluttered with a bunch of things that say, hey, Mr. Smith called for the 5th time today about his bill. We can't put that in the medical record. So the CRM is going to give us a home. Ultimately, I would love to see our customer service and central business office on the same CRM, because we do get patients that call our clinical contact center with billing questions, and we can't see what they can see, and we don't know what they talk to them about, and they don't know what we talk to the patient about. That type of information, that's going to be hugely powerful for us when we spread out into those areas.
Excellent. All right, we're going to go with our polls now. So you see the polls. We've got 3 poll questions there all at once. So we'd like you to take a moment and answer those, and then we'll discuss the result. So let's just go through them briefly. Please describe your current view of CRM. You are using one. You're using one, but you're looking to expand utilization. You're evaluating your options, or you're not evaluating. Next question, which EHR do you use? And answer, select all that apply, use multiple EHRs. And then, do you have a defined business imperative, goal, or objective focused on innovation, consumer engagement, and or digital transformation in FY 2018? We just want to get a sense of where people are with these things. So if you could take a moment and answer the poll questions, we would appreciate it. And then we will come back and look at those. All right, next question. We're going to go with Matt on this. Having worked with many health systems, what do you see as common pain points out there?
Sure. No, it's a good question, and I think, I'll touch on the back end of my response, sort of what we're trying to do to eliminate some of those pain points. But I think first, we mentioned a few times on the call today having that more holistic view of the patient, and I know often, that there's a view that every system out there, is trying to say that they can be that system of record, that centralized source. But I think that's a challenge, right? Just being able to have that view, regardless of what system that is. It's important to have that view of the patient, especially in the system where those key interactions are happening on a consistent basis. The second area that I think are common pain points is the lack of collaboration or coordination. I think Doug mentioned sort of, on the advocate and support side, but if you even think about across facilities, across teams, across service lines, and we see organizations, not only that the teams don't talk to each other and collaborate and coordinate, but completely disparate technologies, right? And if you have that environment, it's very difficult to provide a seamless experience for that consumer or patient. And so being able to drive more coordination and more collaboration, whether that's being able to share data, whether that's being able to share tasks, workflow, whatever that might be. A final few items I would say that I've seen is, to my point around disparate systems, is point solutions. Healthcare historically has been an industry that when they have a problem, they solve it with a point solution. This is an issue we want to resolve, and we go buy a solution to solve that. And I think you see that with some of the recent influx of new startup companies and new technologies, and some of them are fantastic capabilities. The question is, how do you make sure that you don't create a very disintegrated environment from a technology perspective so that's even harder to deliver the services you want to your patients in the future? And so identifying that and saying, hey, how can we leverage a technology to possibly solve multiple issues across multiple areas of our organization? I think another pain point is, what's next after an EHR, or how does this work in coordination with an EHR? And that's probably a whole separate conversation that I won't get into today. I think the short answer there is seeing the CRM as an engagement layer for data that exist in the EHR and elsewhere, and it's further extending the EHR for areas where they're historically not focused, things like consumer engagement, right, campaign, inbound calling, right, screen popping, this holistic view. Those are areas where we're seeing a lot of penetration, things like possibly doing nurse triage or referral management, et cetera. And then finally, one of the other pain points is just being able to establish a framework for how do you deliver on some of these robust goals that healthcare organizations have. So a few years ago, you probably would, just like I mentioned, you probably wouldn't see ads for healthcare organizations on TV. You probably also wouldn't have seen a lot of chief innovation officers at health systems. And so now that you have, dedicated investments in that area, what does that mean for organization, and how do you align the goals for innovation, for digital, to technology, and then help to drive out the processes? And I think what we've seen is we've tried to take our learnings from other healthcare systems that we worked with, leverage a CRM platform to build, in some cases, accelerators that say, hey, we have other organizations like yours. We can help you alleviate these pain points quicker, faster, easier. So that's my view of the world.
Very good, very good. All right, now let's look at our poll results. And you should be able to see those now. So we see that 43%, the majority on question one, 43% are evaluating their options. Only 14% are not evaluating, and the rest are using or looking to expand. So a lot of people evaluating options out there, Matt. What do you think of that?
It's not surprising, right? It's certainly not surprising. I think, whether it's Salesforce or another CRM or just the reality, I think in the industry today, it's become a key part of the talk track. I think that's why we wanted to make sure we did this webinar today, right, is that this concept of replacing the customer in CRM with consumer in CRM is top and center. I mean, if you look at, just to jump ahead, the other question as well, where you have, do you have a defined goal, right, and you see 50%, right? Again, half of the organizations that are on the line today are focused on innovation, consumer engagement, digital transformation. Well, the natural path, if you have that as a goal, is to look towards CRM as a technology that can help you achieve that goal. So certainly not surprising, and I think it's the way that the market is certainly going, notating that you need to take a pretty defined and focused approach for evaluating, as Doug outlined.
Very good. All right, Doug, back to you. What were the immediate goals of the project, and what are the longer-term goals of the project?
I think, in the previous questions, we've talked about a lot of these. Our immediate goal was to make sure that we got the information more accessible to the advocates in our contact center. A lot of what I've talked about is sort of long-term and pie-in-the-sky type goals, or not pie-in-the-sky because they're all achievable, but in the beginning, we've got to get this core of our workforce used to working in this environment and getting information quickly and being managed through their workflows. And again, we wanted to ensure that we could inventory our calls. We want to know why our customers are calling us. We want to know how many are calling for appointments, how many are getting what they wanted, how many don't. Things that we were previously asked to keep track on little tick sheets and little spreadsheets. And you can imagine with 4 million contacts a year, that's not a very practical way to get to know your customer base. We wanted to be able to schedule more effectively and get that right information with the right doctor in the right place. We want to make sure that our patients could land in the proper location and get the service they needed their first time. And that's really what we're trying to do here early on.
Very good. All right. Did you do an integration to Epic or any of your other EHRs?
Yeah, we have just to Epic, and we have, right. I believe we used the CTI integration, and really all we're pulling is the demographic stuff for now. We're getting all of their information, their name, their address, their gender, language, PCP, email address, MRN, that type of information. And once that's populated, and generally we authenticate our patients through 2 identifiers in our voice recognition system so that when our advocate answers the phone, our case is already populated with who they are and why they're calling, which is going to be immensely satisfying for our patients so they don't have to repeat things a number of times, and we'll have some immediate resolution for the questions that they're calling for available to them. So that's hopefully going to be a real quick win for us. We'll also see all of our recent and even older, but our past interactions of why the patient is called. We'll be able to see if they have an appointment coming right up. A lot of those things are populated for us, which is very handy.
Excellent, excellent. Matt, over to you. What have you seen as best practices for the implementation and uses of these systems?
Sure, that's a good question, and I think there's probably two responses here. I think first is in terms of just selecting technology, what are the best practices, and then as it relates to CRM. In terms of, relating to, I guess both of them, answering both those questions together, first I think it's very important to establish a phased approach or a vision, right? What are you trying to do with the application? What are your goals in the short term and the long term? And I think Doug outlined really well. Although their ROI metrics might not have been the exact ones that everyone would expect, they are well defined and they knew what the goals of the actual project was. And I think that's helped us establish the right roadmap. So first is establishing that and recognizing that that roadmap may be one or multiple phases and it may be over time, right? What's important though there is over time, there's a lot of quick wins that you can get with these type of applications because they're cloud-based, because they're configurable, and so these aren't necessarily multi-year projects. Within 3 to 6 months you can start seeing results, right? Second is who's the owner of the application, right? Both during and after, right? Whether that's a hybrid between the business and IT, but making sure it's clear who's actually going to be able to maintain that application, both what's built versus also what might be enhancements in the future. Executive level support, that's any technology engagement. Obviously, Doug was very tightly aligned to this initiative, but also end user feedback is just as important, right? The worst thing you can do, especially with a CRM application, right? Historically, because it started with salespeople, the view was always, this is Big Brother. This is why I'm rolling out CRM. And I think you need to make sure that you need to get end users involved very early, have them buy into the value of the application to do their job, how it's going to help them, how it's going to make them drive better interactions with patients is very important. And then finally, I think the final two, right, is obviously, and it's a, selfish plug with the reality is who's going to help you be successful with the implementation, right, and evaluate your options, find someone that understands your business and is willing to partner with you. And then how does data play a role in the overall effort, right, and making sure you don't underestimate the value of data, how you want to use that data. That's one piece of the puzzle. The second piece is how you functionally interact with the data. And so I think net-net, it's just having a very informed evaluation process that takes in consideration what you're trying to do in the near term, what you're trying to do in the long term, and not think about it as one disparate need. Think about it as a platform that can help solve challenges across the organization.
Matt, when you're meeting with health systems, do you find that most of the people you're meeting with have a vision that matches up with the reality of what can be done, or are they coming in way over the top in terms of what they want, or are they coming in underneath, meaning they don't realize all the things that can be done? So are you getting a variety from the different people you meet with? I'm just wondering, the health system executives, is their vision in line with sort of the reality of what can be done?
I think it's certainly a variety, right? I think you have a subset of organizations that have an initial pain point that's relatively low-hanging fruit, but when we start speaking to them about what else is possible, they have some revelations like, oh, well, that makes sense too. And so you certainly have that group. I think you have the secondary group, which is very well aligned. They understand technology. They understand what they're trying to do as an organization, but they want to bite off a small amount first and just know definitely what this initial project might look like. And then you certainly have organizations that have incredibly innovative and very high-level goals and great visions. Sometimes those can be addressed and those are actually achievable. Oftentimes we see organizations that don't recognize things like change management within the organization, or the investment needs to be made in order to achieve it. So the good news is that across that continuum, everyone is thinking about how can they be better and how can they innovate. The question is, to your point, how do you align expectations and set realistic goals for where your organization is, whether that's from a change management perspective, from a technology perspective, from a pain perspective. So certainly all different areas that we're seeing today, but I think that's part of the excitement and the challenge within the industry today that at least motivates me is how do we get all of those types of organizations that are also all different size organizations to leverage the same technology. And that's pretty compelling that one technology can be used for a multi-site family practice or for a large enterprise hospital. That's pretty exciting stuff.
Very good. All right, we have an audience question, and I want to get in front of you, Doug. Can you talk a little more about how your advocates access the information they need to take care of a patient calling in? Is it all in the workflow, or do they access other info elsewhere?
This is the best part of the CRM from an advocate point of view. They were pulling out notebooks, looking on our SharePoint, looking at Post-its on their monitors. Now it's all right in the CRM. There's actually a Google search bar type tool right in the CRM. They can pick the topic they want, and they can hyperlink right through it like you're navigating through a web page to get to the information that they need. It's a really slick tool, and as our advocates go, it is the #1 selling point we've had so far in getting them to acclimate to the software. So it's a real win for us.
Very good, Matt. Let me ask this audience question to you. It seems to me there are, and I touched on this a little bit with a question before, it seems to me there are several categories of software looking to be the 360-degree view of patient and engagement platform. Care management platforms, HIE platforms, telehealth platforms, PHM, DW platforms. How do you see that sorting itself out without redundancy?
Sure. Yeah, it's a great question. I alluded to it a little bit, right? I mean, I think first of all, I would say, #1, you have to evaluate not in a vacuum, right, which often happens in healthcare, right? And so don't just evaluate a need for care management or for telehealth. Evaluate over the continuum in the patient life cycle, what are you trying to achieve, and can one platform actually solve that? The second question around redundancy is, what are you trying to do, and where are the interactions actually occurring with the patient or the consumer? Right, and I think often what we see is, although there's certainly capable databases out there, the question is how are you actually interacting with that patient, and when are you interacting with that patient, and should you be using one system for all of those various interactions, right? So, I mean, yes, certainly we see instances where we have organizations that have some of these other platforms. What we're finding more often than not is those platforms are actually serving as data feeds and inputs to the CRM. And the CRM really becomes that holistic view, mainly because a lot of those other platforms are very still clinically focused, right? Think about care management, think about telehealth, right? It's a clinical interaction, it's a clinical activity that you're really focused on, but there's a whole host of things that are occurring outside of that clinical life cycle, and that's where the CRM is really powerful. Even think about appointment scheduling. There's a lot of different types of appointment scheduling that today don't exist in a CRM, that don't exist in an EHR that we're capturing in the CRM. So when a patient calls, you can know about every appointment they had, not just the ones that are tied directly. So I think my answer is you need to, again, evaluate what you're trying to do as an organization, but also, understand ultimately what those platforms are actually good at, what data they're actually tracking, and where the gaps are. So we certainly do integrations to a lot of those different platforms, but I wouldn't say that we see a ton of overlapping competition or redundancy with those specific ones that are called out given what they are actually delivering on.
Very good. One more question.
Can I add to that?
Yeah, please, go ahead.
Sorry, I'd like to add to that real quick. When Matt mentions how it's not necessarily redundant, when I think about, say, our transplant program, they interact with a lot of different clinical databases and things that need to be done, but something like a CRM could coordinate a whole host of activities that need to occur for a patient, and rather than one case manager or one nurse manager trying to remember to tick boxes or look through an Excel spreadsheet to see when things got done and if they got done, this tool could actually organize all of those activities, create ticklers, remind people to get them done, double remind them when it hasn't gotten done, and make sure that all of those needs are met to manage that complex case. And I think, again, it doesn't create redundancies, but it allows you to keep track of all of those things that you need to be managing on a day-to-day basis.
And just as a final question for you, Doug, it sounds like you are pretty excited about what could be done or what you're going to be able to do with this tool once you settle in and sort of, you know, get your feet wet, and the possibilities sound pretty exciting.
Oh, absolutely. You know, I had, without knowing it, many years ago I built a similar tool for when I was managing one small practice, and we managed all of our activities through this sort of database. And now working in such a large, complex organization, I can see a lot of opportunities. I have enough of my own area that needs oversight and coordination that it's going to take me a long time to work within, but I could see huge implications for this across the health system.
Matt, final question for you, give you the last word. Folks that are saying, not right now, got too much on my plate, need to push this down the line in terms of prioritization.
Yeah, I would say, you know, in terms of prioritization, I think it should be a priority. I think what I would at least, you know, challenge each of you to do is to at least explore and learn what the capabilities of a CRM can do for your organization, because I think what you're going to find more times than not is the other items that you're actively pursuing are things that the CRM can either do, the CRM can integrate with, or the CRM can facilitate. Right, and so I think it's less of what's more higher priority. It's actually establishing what is the right technology to help you do what you're actually trying to do. So it's certainly something that we're seeing a lot of momentum around, and more organizations evaluating than not.
Excellent. Well, that is about all we had time for today. When you close out your WebEx window, you're going to be taken to a post-event survey. Please take a moment and answer it if you would. Regarding continuing education, those of you who hold the CHIME CHCIO certification get 1 CEU for attending our events. Please let CHIME know you were here, and if you've asked us to do so, we will. If you need a certificate of attendance for another CEU program, you can use the final slide in this deck. You'll receive an email when our archive recording has been posted to our YouTube channel. If you'd like us to produce a webinar on the topic of your choice, you can reach out to Nancy Wilcox from our team, and you can go to our website to view our upcoming schedule of events. So with that, I want to thank our panel, Doug Ditri, Matt Gretczko. I want to thank our sponsor, Silverline, for making the event possible, and I want to thank you, our loyal attendees, for coming to our events. So with that, everybody have a wonderful day. Thank you.